the root cause of this rise of respiratory disorders in India specifically?
Now, with increasing exposure to the smoke, maybe cigarette smoking or smoking, or with the pollution rising, one of the major triggers of an asthma attack is a cool, dry air. Nowadays, it is a very dry sort of season. Keep yourself well hydrated.
One is someone who's smoking today actively, one who's not smoking today. What are your top tips of preventing lung cancer?
For smokers, they have to quit smoking. The first and foremost thing. For a non-smoker, I would say higher weight or maybe say sedentary lifestyles, they also cause increase in cancer.
What mask do you recommend for people to wear?
The only thing which a mask or a surgical mask will prevent will be the dust particle. Rest of the things will pass through a normal surgical pass. If you are prone to these sort of things, then you will have to wear a N95 mask. If you are more than 40 years of age, get at least regular annual checkup. If any disease which is picked up early is easier to treat and it is curable.
A very good evening, everyone. This is Khushbu Agarwal, founder at Zyla Health. As we all know, November is dedicated as a month to COPD, asthma, as well as lung cancer. These diseases have created a havoc in the society, and it's important to understand where they're coming from and how to deal with them. Today, we have the pleasure to have with us Dr. Navneet Sood, who's an expert and renowned pulmonologist holding 23 plus years of experience. Dr. Sood specializes in treating asthma, COPD, and other chronic lung conditions. He has expertise in advanced diagnostic as well as therapeutics for various lung diseases. Dr. Sood has studied from the prestigious Sir Gangaram Hospital and right now practices at Narayana Hospital, Delhi. Thank you, Dr. Sood, for joining today. Great. So, as we start this conversation, Dr. Sood, we understand that 1/3 of the Indian population, adult population today, is dealing with some or the other form of chronic respiratory disorder. We wanted to just first focus on and bring to our audience's attention the root cause of this rise of respiratory disorders in India, specifically the cities. If you can shed some light on that, sir.
So initially, to start off with, the first thing is that initially the lung diseases were primarily the infective in nature. You had a lot of pneumonias, you had a lot of infective lung disease. Now, with increasing exposure to the smoke, maybe it cigarette smoking or smoking, or with the pollution rising, plus also added to it is advanced diagnostics also. So you see in rural areas, a lot of people do have lung problems, but they think it to be a normal sort of aging sort of process. They keep on taking chulla exposure, they keep on taking hookah exposure. So those sort of things are there. With advanced diagnostic, you tend to then diagnose these COPDs and ILD. Basic, that is one of the parenchymal lung disease. So that is primarily causing, and obviously in the cities you have a lot of pollution. In fact, pollution has been there for a long period of time, but the long-term effects are now coming up. You might see a lot of children, you might see a lot of elderly who are getting admitted to the hospitals time and again. We see a lot of children who come to us, they are also reluctant to go and play out because of this problem of exacerbation of asthma. And elderly have COPDs, and obviously some asthmatics are also elderly. So combining all these things, environmental factors as well as your lifestyle things, they tend to increase the chances of having lung disease.
Got it. Thank you so much, Dr. Sood. So I understand that there are a lot of environmental and lifestyle factors, but one positive thing that you shared is that it's more in cities because of advanced diagnostics. So, we can diagnose lung disease better today. So, Dr. Sood, addressing the elephant in the room, which you rightly mentioned, pollution, also the talk of the town, given, we are right now reporting from NCR. So, we understand that 22 of the most polluted cities in the world, unfortunately, out of the top 30, belong to India. Right. While we are on a rapid growth trajectory as a country, we are dealing with the perils of rapid development, which is air pollution. So, wanted to just understand from you about, how air pollution actually leads to more respiratory disorders and how can we actually protect ourselves, if you can cover these themes for our audience.
So for simplicity's sake, I would say that a person who's living in a Delhi NCR sort of city, or a city which is equivalent to this, is almost, if not equivalent to, is a half smoker. This is a sort of a new term. So the exposure, a smoker will have a double exposure, and a non-smoker will have some sort of exposure to the smoke. And these all, especially our respiratory problems like COPD and lung cancer, are directly related to smoking. And asthma exacerbations have been also reported, directly related to smoking. So for simplicity's sake, I'll say that pollution increases worsens every lung disease because you are in direct contact with the environment. Apart from these, you have a lot of allergic problems also, because you see, why do you feel the pollution levels are high during this time of the year? The only thing is that the density of air molecules and water molecules is quite high. So the amount of pollutants you inhale with every breath. So just for simplicity, a breath has two phases. One is inspiration and one is expiration. So we inspire in oxygen and throw out the toxic carbon dioxide. Correct. So that is the normal physiology of the lungs. So lung expand when you inhale, and that oxygen goes inside, passes on to the blood vessels and to the blood and to the heart. And the deoxygenated blood, or the blood which is carrying carbon dioxide, is then transfers at that time also the carbon dioxide to the airways also. And when the lung deflates, so that carbon dioxide is during expiration thrown out. Correct. Now, any process which hinders in this whole thing is going to cause trouble. So, as I told you earlier, that COPD, asthma are airway diseases in which the pathway from which air travels from nostrils to the lungs. So any compression, any secretions, any obstruction in that airway will cause difficulty in breathing. The other thing is ILD, which is a parenchymal lung disease, which incidentally is also related to some sort of pollution also. So the pollution is a risk factor in that also, including smoking also. But those ILDs have other risk factors also, apart from these smoking and pollution. So once you have this mechanism, and this mechanism is obstructed because of secretions, you might have noticed, because of allergy or because of pollution, you have watering in the eyes or nostrils. So that watering and secretions which are discharged from the body do also get there in the trachea and as well as bronchioles. Bronchioles is the lower unit of lungs. The lowest one is the alveoli. So those sort of get flooded with the secretions, and then they get obstructed, and then you have lot of compression. So uh, per se, it will always cause difficulty in breathing to a normal person also, but more so in those who got triggered by this thing, asthmatics and COPD. Got it, Dr. Sood. Thank you so much for explaining it in such a nice layman language. So, Dr. Sood, I have a very, very common question that we get from our patients and our users, is that is damage to lung because of various external pollutants or factors, is that reversible or not? Surely it's reversible. So if you have been prescribed some medicines, say asthmatic has been given some inhalers. So we'll talk about the myths of those things later on. But whatever medicines have been prescribed has to be taken. Got it. Otherwise, one fine day you might wake up and
Have
having
difficulty.
congestion and
Yes.
difficulty, and then you'll end up. So we have a lot of patients who come to us in the hospital in the early morning. So I have my emergency guys who call me up at 3 o'clock, 4 o'clock, sir, ये patient अभी आया है. But very frequently. It hardly I got a call in maybe say 3 o'clock in the afternoon or so. That also keeps on changing. So keep in mind that in the night time you have to be more careful than in the daytime because of environmental sort of things. Got it. The other thing is, some people do ask me, what about air purifiers? We can keep it. So what I say is that those who are staying in a single place, say an elderly guy who's in house most of the time, they will definitely get benefit out of it. Those who are going outside, inside, like we are working in a hospital, then I go to my clinic, then I come back to my home. So if I do get a air purifier, my exposure to will be still be almost equivalent to whatever I'm getting. So it is your call. If you have lung problems, then definitely air purifier will help. Otherwise, you need to take. I just read a newspaper report that one house in Delhi, they have an AQI of 15. So what they have done is on their terrace, on their balconies, they have put in a lot of plants. So these are the things which you can, if you have time, those sort of things. We don't have time, so I
Right.
cannot do that. But
Yes, most of our audience on the webinar also doesn't have the time.
So what you can do is you can just keep your surroundings to be a little more sort of green sort of thing. And these are the basic tips which you can use.
Very,
So
very
I
well said.
think hydration is very important, which
Got it.
normally a lot of people do miss.
No, thank you, Dr. Sood. You spoke about vaccination, you spoke about humidifying your environment, you spoke about hydration, and then you spoke about keeping your environment clean and green. So just covering on some, double clicking on some of these aspects, Dr. Sood, some very important things you said, right? So, for example, I as a person, I every year I take my flu shot, right? Whether everyone in my family, be it a child, an elderly, or people in mid age or young people, it just helps you prevent the unnecessary infections which you will catch because you're working, you're exposed to school and office and so on. There's a lot of myth around influenza vaccination. Is it really needed? The risk benefit balance. So what is your take? I mean, what would you recommend to your family as an example on vaccination?
So I'd start off with whatever controversy was there with the COVID vaccine. So you got a report from somebody that there are some certain side effects of COVID vaccine. So I have dealt with COVID patients firsthand, and we were the healthcare workers were the first one who got the vaccines. So just for an example, because we are talking on vaccines in the first COVID wave, because all of the hospital staff was getting admitted under me. It was through me who were getting admitted. So I know the data of this thing. So in the first wave, we had about 50% of staff which got infected and got admitted. But in between the first and second wave, we had this COVID vaccine. And that ratio reduced to 10%.
Wow.
So what I say is that there might be some side effects of everything. And you drink water, you have tea, you have coffee, there will be effects, there will be side effects. The only thing which you have correctly asked is what are the risks and benefit ratio. So the benefits of these vaccines, especially influenza vaccine, outweigh the risks to a large extent, because 40 to 50% of times the infective component of this asthma and COPD exacerbation is primarily because of these two organisms. Otherwise, there are thousands and crores of organisms which can infect you. But most of the time, these two will cause. So you can, at least out of 10 infections, if you can prevent 5 of them, then it is very good for your lung health also. Because every infection, every hospitalization puts your lung back by say 10%. So then it starts
again,
recovers, and then it might not recover to the same level also. So whatever damage has been caused. So please try to avoid infections.
Correct. So healthy or with lung issues, influenza vaccine every year is recommended to keep your lungs healthy and in good spirits. Thank you so much, Dr. Sood. And then you also spoke about humidifying and air purifying houses. So let's just burst some myths around the indoor air and how that also has to be maintained, because if we completely cut off ventilation for months inside a house, is that even healthy? Right. So if you can just throw some light on indoor air pollution and how that should be managed, Dr. Sood.
So indoor air pollution is more so common in rural areas where there is no concept of ventilation. But nowadays in our cities also you have a closed sort of chambers, centralized ACs, and there is no ventilation. So what happens is, say supposedly you are sitting in a airplane. There are 50, or in a cinema hall. There are 50 or 70 or 100 people who are sitting beside you. So, and that is a closed space. So once a person has thrown out some infective sort of things in the air, you are likely to get some sort of these things, sort of things. So ventilation is basically for the removal of and or circulation of the air. So I remember we made certain extra ICUs during COVID time, and that time in the ICUs, it is mandatory to have circulatory. So AH, if it is a makeshift ICU, then you don't have those AHUs. So normally centrally ACs do have a circulatory sort of thing, but we had to make a makeshift ICU, and that time we had to put in large exhausts. We have to remove the ACs and put in large exhausts. So that is basically primarily because of reducing the load of the infection as well as pollutants, whatever it is.
Got it.
The air circulation, if it is not there, then the exposure is quite high. And as you have rightly said, in say a studio apartment or a lot of things which are do come up, a lot of builders do not take care of the ventilation part. They will put in glasses and everything else, but the ventilation is not there. So if you are living in those sort of things, I would suggest you to at least open your door for some at least 15-20 minutes if it is possible.
Especially in the day when it's sunny.
Yeah, avoiding those morning and evening hours.
Got it.
So whenever there is some wind flowing, and so let the air circulate. So that is very important.
Correct. Thank you so much, Dr. Sood. I think those tips around hydration, purification of air, humidifying of air, vaccination are very, very important for people to learn. And personally, I keep a humidifier, in my room when I sleep, right? It helps my child, it helps him prevent congestion.
Sure.
And these things don't cost too much, right? 1500
Right.
rupees to 1700 rupees, and it will last 3 to 4 years. I think it's a great purchase for someone, trying to reduce lung burden on the family. Thank you for sharing that tip. Okay, so sir, now just moving on and understanding some various other aspects, and truly a pleasure for me to learn from a COVID warrior. So heartwarming to learn about your stories. I'm sure it got very, very very, very heavy for you at that moment to deal with the existing chronic diseases and then COVID. So talking about the regular chronic lung diseases, Dr. Sood, which is asthma and COPD, if you can help our audience understand what is really, in simple words, what is asthma, what is COPD, and someone who's not living with these diseases today but is facing certain breathlessness at some points in time during climbing stairs or when they're sleeping, how do they know that this could be a lung disease and I should see a doctor?
So the first and the most common symptom of a lung disease is dyspnea. And I would say dyspnea on exertion, or dyspnea, shortness of breath in normal term. So shortness of breath on exertion. So what is exertion? So it is different for different people. Say I normally jog for 5 kilometers, and now I am getting shortness of breath even on 1 kilometer. So 1 kilometer jogging is not a small distance. So if somebody comes to me and tell me I am getting a little shortness of breath on running 1 kilometer, so I would say, oh, it's normal sort of thing. 1 kilometer is quite a big distance. Even if you get a little short of breath, that is fine. But then the next question is, so what was your baseline? So if he says that if it was about 5 kilometers, I used to run 5 kilometers, that time I did not have these problems. So then you must have a little thing. Either it is a cardiac issue or a lung issue. There is something going on. So one is the shortness of breath. Then cough and sputum and wheezing. These include, and one is hemoptysis, that is blood while coughing.
Okay.
So that was included in primary things because there was a lot of tuberculosis patients. Although ABB, we see a lot of TB patients, but not as much as I maybe at the time of my doing post graduation. That time we used to see a lot of those. But these primarily for chronic lung disease are things.
Okay.
The basic crux, the difference between these are, as I have already told you, COPD and asthma are airway diseases. So in asthma, the airways are flooded with secretions, and they get blocked, and then oxygen is not able to go inside the lungs and don't pass on it. And that is a dynamic obstruction. So say when the lung is inflating, then the airways are open. But once they are collapsing like a balloon, the secretions are so much that the airways, they close down, and it does not allow the air to go back. In COPD is a different ball game. COPD, there is lot of destruction of the lung architecture also. So these two, but the secretions are almost similar in both the two. So first thing is the difference in these two. So airway, when they get constricted, there is a hindrance to passage of air, either during inspiration and as well as during expiration, more so in expiration. So that is an obstructive airway disease. So what we treat during their exacerbations or in normal thing also is that we tend to give some medicines which will improve the the airways. The constriction will be relieved and the mobilization of the secretions will be good. So a person who says that मैं कफ मैं मेरे को खांसी आ रही है बट मेरा बलगम निकल नहीं पा रहा, मेरे को कंजेशन लग रही है, ठीक है, यू माइट हैव नोटिस समटाइम्स somebody saying this thing. तो उसकी बलगम जब निकलती है तो he feels a little relieved. So once he throws out his mucus and secretions, whatever it is, whether that is due to infection or due to other stimulus like pollutants, is a different matter altogether. Got it. So normally it starts with allergy or pollution, but then because there are a lot of secretions, they tend to get infected also with so there are double whammy for the lung. Got it. So the thing is, a simple thing for everybody is that keep your muscles, respiratory muscles intact. Your cough effort should be there. Keep on taking medicines which have been told, like say a bronchodilator or inhaler. अब मैं if I say somebody कि take inhaler regularly, there are a lot of myths in the society, है ना, मैं तो मेरे को आदत पड़ जाएगी, मैं तो इसकी आदत पड़ जाएगी, मैं कैसे करूंगा, मैं नहीं हो सकता, ये नहीं मैं लूंगा. कीप इन माइंड, आप उसको you will keep on taking those COPD and asthma sort of things with you, but your lung is getting deteriorated. You might not perceive that sort of thing. Correct. We have a lot of diagnostic tests now available. A simple test is peak expiratory flow rate, which you can yourself use. Anybody at home can use. Okay. How do you do that? So there is a small peak flow. You just have to blow inside it. It will give you the pressure or the force with which it can go. Okay. So there are benchmarks which are set. So the one which is a ball and... No, that is incentive spirometer. That is a different sort of thing. So peak flow is, we normally give it to the asthmatics. Okay. So if it is less than say 250 or less than 350, then it is mild, moderate and severe sort of thing. And that is used for monitoring of your asthma also, because a lot of people do not perceive it. So got it. Only yesterday I had a kid who came to my OPD. I asked him, his mother was very concerned. He was about 8-9 years of kid. So, कोई problem है आपको? So the kid said, नहीं, I am fine. तो मैंने कहा अच्छा, तो I just talk to him like this. अच्छा, कौन से स्कूल में जाते हो, ये करते हो, करते हो. So what do you play? तो मैं खेलता नहीं हूँ. मैंने why don't you play? You don't have any friends? नहीं, मेरे को सांस चढ़ जाता है. So lot of people do not have the perception कि मेरे को problem है. Same with kids, like they live with poor eyesight for years and later realize it's same with lungs. तो वो क्या है ना कि you will have if there is no perception, then there is problem कि हाँ ठीक है, मतलब मैं ना इसको लिमिट ही कर देता हूँ. Say if I run for 1 kilometer, I get breathless. My body is or my mind is tuned to this कि मैं 900 meter पे रुक जाऊँ. I stop at 900 meter because 1 kilometer पे तो मेरे को सांस चढ़ जाएगा. Understood. तो वो the perception is, तो you have lot of diagnostic. तो peak flow meter is helpful in that. इससे बड़ा है PFT, that is pulmonary function test. Course. That gives us clear indication कि इसका airflow, the lung functions are poor, and they might improve with the treatment which we give. Got it. So we have a pre and post PFT. Then we have other things which we can do in ILD, especially we have CT scan. In lung cancers, we have CT scan. So these sort of things are quite now an advanced age. So nobody misses a diagnosis in present era,
Got it.
which we got missed in the earlier times.
So, Dr. Sood, what you're saying is if someone does not know or does not have a disease today, an asthma or a COPD, the clear indicators where you must go to a doctor, one is shortness of breath, which is sudden and worsened than a baseline. Second, you're talking about cough and sputum, and the fourth was blood when coughing. So just double clicking on this because a lot of people may be living with symptoms and misdiagnosed, not diagnosed. Talking about cough and sputum as such, if we can just elaborate on that, what is a bad cough and what are the different colors of sputum and what they mean? If we can just throw some light on that.
So in simple terms, I'll start off with the color of the sputum. So if it is a whitish sputum, which we normally find in our COPD patients. So COPD patients have round the clock, round the year, this sort of early morning sputum, which is whitish, thick, tenacious. A pneumonia guy or an asthmatic guy will have a yellowish or a greenish sputum, which will indicate that it is very likely to be
An
infective.
infection.
Blood in sputum is a sort of a scary sort of thing for a lot of patients. So they normally run to the doctor whenever there is blood in sputum. Other things they keep on taking for maybe a week or so, or go to GP and see what is he's doing. So especially for ILD, I'll tell you, a person having shortness of breath or anything else, a blood in sputum comes out and his X-ray shows some infiltrates. The GP will give him, and there are a lot of people who will give him a tuberculosis treatment.
Oh, it's misdiagnosed.
So it's misdiagnosed. The ILD keeps on simmering on for maybe 6 months, 1 year. Chalo, thoda sa theek ho gaya, nahi ho gaya. But he then gets tuned to those sort of conditions, the person also.
So if someone is told by the doctor that they may have tuberculosis, they start getting treated for it. What is a confirmatory test, Dr. Sood, that they should do?
So I think everybody should have at least sputum test. So we have a lot of people who come from, especially from periphery, कि मेरे को एक्सरे में वो उन्होंने कहा था, डॉक्टर साहब ने एक्सरे में मेरे को शैडोज दिखी और मैंने टीबी का ट्रीटमेंट ले लिया. अब मेरा ठीक नहीं हुआ, 6 महीने ले ली, तो मैं अब दिल्ली में दिखाने आ गया हूँ. So this is a very common sort of situation. So first of all, the diagnosis of TB in today's time, you have to have sample. Either you have sputum positive or you have. So we have advanced technique in bronchoscopy. Bronchoscopy is endoscopy of the lung. So you must have everybody seen endoscopy. Yes. Endoscopy of the lung is bronchoscopy. In bronchoscopy also you have an ultrasound guided by and bronchoscopy. So you have lymph nodes which are normally present in the enlarged sort. If they are enlarged, then they are primarily, they may be cancer, they may be lymphoma, they may be tuberculosis, they may be sarcoidosis.
Very interesting. So Dr. Sood, if you can add a little bit here on when you're looking at an X-ray or in more advanced imaging of a lung, what is it that you're looking at? What are you looking for?
So there are a lot of things which you look at it. So in a COPD X-ray, it will give you a picture of an inflated sort of lungs because of the destruction of the architecture. Asthmatics X-ray will primarily be normal.
Okay.
So if somebody says ki I have asthma and this is an X-ray and X-ray is showing nothing, I have to tell him that X-ray is not going to show something unless there is pneumonia or there is an infective sort of big pneumonia which might be present in a normal patient also. But asthma exacerbation can also be there with the absolutely normal chest X-ray. So those sort of things are there. ILD will have some infiltrates and lot of GPs or other physicians will misdiagnose it at tuberculosis.
Okay.
They need confirmation with the CT scan.
Okay.
So you need a further CT scan and bronchoscopic biopsy. You need further evaluation of those sort of things to then start off, because then there are certain things which you start off with, and maybe say in a COPD I'll start off with something, in asthma I'll start off with something, in ILD I have to give steroids. So I cannot have a condition in which there is a patient who's having tuberculosis and I give him steroid, or if a patient has got ILD I give him anti-tubercular treatment. That is also having
So
some.
if a GP tells someone that they or their family member may have tuberculosis, a sputum test must be done
Sputum must be
to
done.
ensure that this is not
If
being
their sputum
suspected.
is not forthcoming, then bronchoscopy has to be done.
Okay.
If that is not there, or if there is nothing else, if there is no other indication, then it is very unlikely that it will be tuberculosis.
Got it. Got it. Thank you so much. So, Dr. Sood, we have started getting questions from the audience. I'll keep covering them in
Yeah,
between
yeah,
so our
sure,
audience,
sure.
stays engaged. The first question is it safe for elderly to walk in cities in mornings and evenings?
We have answered this thing.
Yes.
At least not during these times. Say maybe you can stop going out in September, October, November, and maybe whenever, just a simple thing is whenever the wind is blowing or the rainy season is there, then you can go comfortably. Pollution levels will be on the lower side. But whenever either of these two is not there and there is smog, so just avoid those sort of things. They go out for walk at about, I normally tell my patients to go out after lunch. So a
Okay.
lot of people do tell me, यार sir मेरे को तो नींद आ जाती है, ये हो जाता है, वो होता है." मैंने कहा, there is no other time in the day when you can go.
Got it. And Dr. Sood, just demystifying this bit on masks, right? The various masks that are out there in the market today. There's N95, there are other masks that people are wearing. People are wearing surgical masks, cloth masks. Are masks really helpful in preventing the external, I would say, pollutants or irritants? Even when there's no pollution, there may be irritants, right? There may be dust. What mask do you recommend for people to wear? When should one wear it? Is it really helpful?
So the only thing which a mask or a surgical mask will prevent will be the dust particle. Rest of the things will pass through a normal surgical mask. If really, if you are prone to these sort of things, then you will have to wear a N95 mask. Now, N95 is a difficult mask. All of us have experienced this thing. We had at that time had to
Yes.
wear it for a long period of time. So N95 is very difficult to keep wearing whole of the day and while working also. But then that is the only mask which is really helpful in keeping out viruses, bacteria, and smaller pollutant particles also.
Right.
The only thing which will be avoided by wearing a normal surgical mask will be large dust particles. That themselves are also that there is a nasal cavity. You might have noticed there are hair and everything else.
Correct, correct.
So that is a normal human filter of the air. So those big dust particles do get trapped in this thing. So I don't think practically normal surgical mask is very helpful. If you are prone to it, then I will tell you to wear a N95 mask.
Okay.
And avoid going in a crowded place especially during this time of the year.
Okay. So if we have to really avoid air pollution and we want to protect ourselves, N95 is the only effective mask. Otherwise, we are just mentally convincing
Sure.
ourselves with a placebo. Makes sense. Okay. And another question, Dr. Sood, that we have from our audience is around some daily home remedies such as steam every day to prevent cough and cold in winters or in air pollution or any other things which you have seen working for kids or elderly or otherwise.
So I think we have already touched upon it a little bit. Keep your environment a little humidified. So those who have some certain part asthma or some allergic rhinitis also, they will be helped by this steam. Not excessive steam, maybe 10 minutes in the morning, 10 minutes in the evening, just to get mobilized, the secretions get mobilized and they can be thrown out. Use mucolytics. Normal mucolytic, I normally like, lot of my patients I normally give mucolytics also.
As an example, sir?
So mucolytics are basically some medicines and some natural things also, which tend to thin out the secretions. So thin out the secretions means that they are easy to throw it out with the cough. You might have seen a lot of elderly people who don't have that cough effort also. So if there is a thick secretion, they are not, the cough effort or cough force is not that much that they throw it out, and that keeps on accumulating there. So especially in the elderly, keep on using steam, and maybe if it is quite severe, then use mucolytics.
And sir, what can are these over the counter medicines?
This is
And
fairly
okay,
over the counter.
okay,
Lot of cough syrups are also having mucolytics, but they do have other things which are not
correct,
required.
correct. So if one has to buy this at a pharmacy, what do they tell the
So anything,
pharmacist?
one medicine is Ambroxol. So they have a
Ambroxol.
lot of brand
Mhm.
names. The other is an acetylcysteine.
Okay.
So they have some nebulized forms also.
So mucolytic is the common
Is
word.
a thing that because the basic problem with most of the lung diseases is accumulation of secretions.
Mhm.
So that we have to reduce.
Got it.
Apart from obviously preventing the infections and as well as reducing the exposure load of the pollutants,
Mhm.
these things can also help.
Got it. Got it. And talking about cough syrups, which you just touched upon, there is a lot of misuse of cough syrups in India and even abroad, outside India. So, what is your take on usage of cough syrups and how can we prevent the misuse, Dr. Sood?
So to tell you, in my practice use cough syrups in 5% of patients only.
Hmm.
With me being a
Wow.
pulmonologist, so 95 out of 100 patients are having all my patients are respiratory patients, but I use cough syrups only in 5%, and those 5% are those in which I want to suppress the cough. Say a person having throwing out blood, so then I want to suppress the cough because then some artery or some vein has got damaged inside, and any cough will aggravate that thing. So that is the only time which I use to suppress the cough. Other times, as I've already told you, we need to get those secretions out and get the cause of secretions to be treated. Say it is infection or allergy, that has to be treated. So you don't need a cough syrup for that thing. The other thing is that if a patient is नहीं जी मेरे को cough syrup लिख दो, there are certain patients who नहीं मेरे को cough syrup लिख दो, then I write something because then the patient is anyway is going to get it over the counter. Otherwise, I normally do not use. And
Got it.
those cough syrup I use in those patients who are not able taking orally. There are we have lot of cancer patients who have Ryle's tube inside. So they're taking medicines as such also by powdering them and taking them as with the solution form. In that case also I use the cough syrup which are not very heavy sort of, and those who are containing singly mucolytics by and large. Cough suppressant's role is very limited.
It's very interesting to hear a leading pulmonologist say that you use cough syrups only in 5% of your patients and misuse should be avoided.
Yeah.
And in kids, apart from steam, is there anything else that is done for improving lung health during cough or infections, Dr.
So
Sood?
I think one is that in pulmonary patients we have a pulmonary rehabilitation. My thesis topic was pulmonary rehabilitation only. So now pulmonary rehabilitation in simple terms is exercise of the lung and its muscles. So a breathing exercise we normally tend to give to everybody. And a breathing exercise 2:4 breathing, or in simple terms, whatever you do in pranayam is a breathing exercise for a medical field. Apart from the spiritual part of it, physical part is that it is a breathing exercise. And we normally do tend to give the balls which you were talking earlier, incentive spirometry. That also helps in generating lot of muscle power as well as mobilization of the secretions.
So if someone is healthy, can even they practice
sure,
this?
sure,
2:4
sure.
breathing,
Yeah,
spirometry.
sure.
And what about Dr. Sood? What about nebulization? We've seen that to be used very over the counter across Indian cities now in kids with steroids and other drugs. What is your take on nebulization as a practice?
So I think nebulizations are the mainstay of the treatment in asthma and COPD. But
someone who's healthy, not even with
no. For asthma COPD patients, they are the mainstay of the treatment, and that too in very limited sort of way, in acute exacerbation when they are not able to take in the breaths. Otherwise, we use inhalers in those cases. In a healthy person, nebulization has only a role whenever there is some acute bronchitis or sort of thing. Okay. So maybe for 5-10 days, and that too we normally do not require those sort of things. Normal medicines should do. A lot of people do take. We have a prolonged sort of cough, and I was advised nebulization by the chemist. So what do I tell him?
Hmm.
So the nebulization has its own side effects. You have to keep it in mind.
Even with non-steroidal medicines.
Even with non-steroidal.
Hmm.
Right? The medicines which are not steroids they cause tachycardia, they cause dryness of the mouth. There are a lot of things which do happen, and
Got
that can cause more harm than good. In case it is not required in your case.
And in kids who are, for example, kids have to play these days outside and it's quite polluted. Does nebulization with saline water help, which some mothers are practicing these days?
So those who are having asthma will be helped by the nebulization, normal nebulizations which we give in the medicines. Saline nebulization is basically a form of humidifying, and that is also not that steam will do the same thing as a saline nebulization.
Got it. And any other tips for kids? We have a question here from the audience for kids who have to play outside because we can't completely make them indoors. How do you manage that?
Yeah. So what I tell the kids is that you cannot, obviously, for even for elderly, you cannot stop their physical activity altogether. The only thing is, first thing which we have already talked, just keep the time of the play to a time where the pollution levels are a little on the lower side. Make them drink lots of water before they are gone, because the water then distributes to whole part of the body, and lungs is also one part of it. As hydrated as lungs will be, the chances of getting allergic and infections will be on the lower side. And if the kid is and if there are certain red flags, if the kid is saying that मैं जाता हूँ खेलने and I have lot of cough and or watering of the eyes, then please avoid it for maybe a week or so. Whenever then pollution levels are high or there is certain pollutants, certain people have problems in April, March, April, when pollution is not very high, but that time pollens are there. So certain people have problem with the pets hairs. So that those sort of things are allergic sort of things. So that you have to identify and evaluate and get yourself evaluated by a pulmonologist.
Got it. Got it. Thank you so much, Dr. Sood. So, another segment that we wanted to cover today, Dr. Sood, is around the big C, lung cancer, right? And we're seeing a rapid increase in lung cancer. So, wanted to hear from you as a pulmonologist, who is an expert in the first level diagnosis. Are we really seeing an increase? And the audience also wants to know, why are we seeing an increase even in non smokers?
So, let me tell you a thing. We are seeing a lot of lung cancer in 30s and 40s, which I used to not to see about 20 years ago, and females. So in our conventional studies, it was basically smokers, males who were on risk factors. And by the time I finished my post graduation, those data had almost equated. So that time, when I about 10, 15 years ago, 20 years ago, when I was finishing my studies, that time adenocarcinoma or cancer, which is basically because of smoking, had come to 40%, and the smokers were 60%. Now the data has reversed. So there are a lot of non-smokers who do have cancer. Obviously, smoking is a big risk factors, but it is not that a person is not smoking and he'll
So you're
not
saying
have.
almost 60% people who get lung cancer may be non-smokers.
Maybe non-smoker, or they might not have exposure to smoking per se, but they might have. There is the thing which I want to just tell you is one message is that a person who's maybe sitting beside you who's regularly smoking, you are also equivalent to a smoker. So there is a passive smoking, the term which is used.
But then there'll be a lot of non-smokers, non-passive smokers as well.
So those are the females. I recently we have 2 or 3 females in 30s. So I've never seen 30s age group female having lung cancer. Non-smokers. Absolutely non-smokers.
And what do you think is the cause, Dr. Sood, and how do we prevent this?
So there are a lot of theories which goes around. One is that your lifestyle changes. Like for the breast cancer, you have weight and diabetes and thyroid, these sort of risk factors, as well as the kind of food we eat, the air we take in. So everything is a risk factor. So one is that. The other is a genetic sort of thing also. So initially people used to miss a lot of things. Lung cancer also used to got missed.
Okay.
because the symptoms come only when it is almost stage 3, stage 4. So nowadays whatever happens is that a lot of people do have access to chest x-rays or CT scans. So you pick up small sort of cancers. You have PET CT where you can see कि नहीं है, this is only limited to this area only. It is not in the body. So that is a very good sign. It will be surgically removed.
Got it.
So diagnostics have also played their role in improving the lifespan also. We have patients who are now free from cancer.
Wow.
For last maybe 20 years now. There are 2 patients who are last 20 years they had been diagnosed. And उन्होंने तो they had made up their mind कि maybe in 4-5 years I'm going to go.
Wow. It's a second birth.
It's a second birth. They do come to me. They don't have any problem. They sometimes do come to me whenever they pass by. So तो आपको डॉक्टर साहब मिलने आ गया type.
Very nice.
So the same is the thing with the lung cancer. The treatment of lung cancer has also improved a lot. You see, there is a targeted lung cancer treatment nowadays. You have certain pills also. It is not only the IV drugs or surgery. Some pills are very effective because at genetic level there are certain mutations which if you can catch with the biopsy samples, then it shows miracles.
So, Dr. Sood, I wanted you to guide our audience, and 2 types. One is someone who's smoking today actively, one who's not smoking today. What are your top tips of preventing lung cancer for these 2 types of people?
So, for smokers, they have to quit smoking. The first and foremost thing. For you as well for your family, they are also getting exposed to the smoke what you are taking. So, if you have kids, the kids are getting exposure to the smoke. For a non-smoker, I would say keep away from smoker. First thing. The second thing is keep your lungs healthy. Your lifestyle change, problems like higher weight or maybe say sedentary lifestyles, they also cause increase in cancer. So please do exercise, keep yourself healthy, keep yourself hydrated, and get yourself checked. If you are more than 40 years of age, get at least annual checkup, regular annual checkup. If any disease which is picked up early is easier to treat and it is curable. If it is in a late stage, then we might not be able to cure it. We might be able to control it. But I think cure is our target. So if anything we can cure something, it is always good.
Very well said, Dr. Sood. So what you're saying is preventing passive smoking, maintaining a clean lifestyle, and early diagnosis. So talking about early diagnosis, and we have a lot of people, who are from different organizations in a work profile. What tests for the lung should be done every year, and at what age should these be, initiated?
So I think for a person who has high risk for cancer, say a person who had a family history of cancer, then I would be asking him to have one LDCT. LDCT is low dose CT scan. So radiology has its own problem. So you have you can do anything, but you need to see that you are giving some radiation to the body. Even X-rays also. CT is giving radiation about 100 times an X-ray. So basic is the first thing is get yourself once at least, if you are above 40 years of age and there are no symptoms, get at least normal executive health. There are a lot of executive health checkups going on which have X-ray, ECG, those sort of things. So if everything is fine, then you continue it for every year. If you find something, say you have some history, you are a smoker, you have some history of persistent cough, small sort of cough, you have family history of cancer. So then you go in for a little advanced sort of thing. You get yourself a LDCT or a HRCT. If you find something on X-ray is a very crude sort of thing. It will miss the finer sort of small sort of lesions. So then go for CT scan if it is fine, then it is very unlikely to be lung cancer.
Okay. So low dose CT scan is recommended these days to prevent.
Yeah, if the radiation is not that thing. If you find something in an X-ray, say if there is a suspected lesion in X-ray, but we cannot say clearly because it is a crude sort of method, then we go in for complete CT. If you find something, then don't go for LDCT, then go for complete CT.
Got it. So, Dr. Sood, thank you so much for that very interesting segment. Wanted to just now cover on a couple of questions we have from the audience. One is around indoor plants. There are a lot of confusions around whether indoor plants help in better lung health or not. So, if you can clear this myth.
I think there's no harm of keeping indoor plants. They'll be helpful only. The only thing is that some persons are allergic to some sort of plants. Those persons will get problems with those indoor plants. Otherwise, I don't think there is a problem with indoor
Got it.
plants.
Great. So, greenery inside can
Yeah.
even help clean the air.
Yeah.
The other question we have from the audience is around building immunity in metro cities. What are the easy hacks of building immunity towards lung diseases when if you're living in a metro?
So our the immunity is now bombarded with a lot of things. One is that say I was in a small town when I was a kid. I did not have any access to the junk food. So it was a party was a one in which my mom used to cook something at home, and even a halwa was a junk food at that time.
Correct.
But nowadays you have availability of pizzas and pastas and everything, so you get bombarded with a lot of young guys normally take it daily. You don't know what is being put in those things. There are a lot
Correct.
of carcinogens which are going. There are a lot of allergens which are going
And
in.
plastic packaging.
And plastic packaging. So one is that please try to avoid as much as possible. Outside food, if you are not able to make it, keep it a healthy sort of food. Keep exercise regularly. Exercise should be in your schedule. Whatever exercise you do, yoga, you do gym, you do running, whatever you want to do. Because the lungs do inflate and deflate, the muscles get improved, then the body releases endorphins. That also improves your mental health as well as physical health.
Got it.
Keep yourself hydrated. That is the crux. And maybe possibly you don't need any supplements. Large supplements are not required. So people ask me, मेरे को ताकत की दवाई दे दो. You take care of your lifestyle. You will not require anything.
Great. Thank you so much, Dr. Sood, for those very, very informative anecdotes about lung health. We learned so much from you today, and such a pleasure to hear from a leading pulmonologist. Thank you to our dear audience for joining us today. This is Khushbu signing off with Dr. Sood. It was a pleasure to host you today. Thank you so much.